Good morning. Uh, okay. Testing, testing, testing. Okay. Testing, testing. Good morning. Okay. Testing, testing. Okay. Everything looks good. So today is Saturday. This is our regular Saturday morning yoga therapy sessions. Today is October 22nd, 2022. Today's session is on yoga therapy, empowering the healer within you. So, yoga therapy is based, excuse me, based on the philosophy of Ayurveda, which is primarily a preventive medicine, which is primarily a daily routine, primarily a lifestyle modification, and tapping into the healing power of our body and mind. In our medical terminology, we use a word called homeostasis. Now we call it a homeokinetics, meaning that our body is always in a state of balance. Our body has 3 trillion cells doing 3 trillion your enzymatic balancing, and always keep our physical and mental body in balance. We get dis-ease because we do not listen to our inner self. So we know that our body is capable of producing every medication that we are taking for our endogenous disease. Just we have to quiet down our body and mind to the state of stillness. What does the stillness means? The health. In Sanskrit, the word, the language the yoga is written is called Shasto. Sha means self and Sta means stillness. A stillness of the self, stillness of the body, mind and spirit is your health. And when you are healthy, you resist disease. Disease won't come to you. The word health, healing, all comes from the old English word hail, which means basically a wellness. So wellness from our perspective is an awareness. Remember, it is an awareness for us to keep our physical, mental, and spiritual body in balance. Yoga therapy says health is the balance of your body, mind, and spirit. So at the level of stillness of your body and mind, we are in a state of meditation. And the meditation is the medication. As I always say, the difference between meditation and medication is T and C. Meditation, T is the transformation, and medication, C is the choice, what you do. So to bring the stillness, what you need to do, you need to put your physical body, in the state of a relaxation response. And primary asana is your Sthiram Sukham Asana. Sthiram means stillness, Sukham means happy, asana is a pose. Your breath also has to be a very effortless, and more relaxed you are, your breath is going to be more and more slower, longer, deeper, and you are not going to even hear or perceive that you are breathing. When mind enters into stillness, which is called meditation, it is entering the gap. Normally we have thousands and thousands of thought process. Majority of our thought process is in the past. Another large number is in the future. Very few in the present. Even in the present, we have about a large percentage are repeat thought process. So enter in between the thought process, which is called a gap, and slowly increase the gap. So you still have the thought process, but you don't have the chattering of the mind, which is called Chitta Vritti Nirodha. Yoga does controlling the chattering of your mind. So as a physician, what we understand about the healer within us and empowering the healer within us, what is the cause of most of our endogenous disease? Endogenous disease means the disease which comes from outside. Which comes from inside. The disease which comes from outside, we call it exogenous disease, like a COVID-19, allergies, flu, the chemicals or the pollutants we are breathing. So, the number one cause of our endogenous disease which we have is a autonomic dysfunction. Imbalance between our sympathetic and parasympathetic tone. And yoga practice is primary activation of parasympathetic tone. So, imbalance of the autonomic nervous system. Second is your alteration of your altered hormonal homeostasis. These are big terms, but basically means we have a hormones in our blood which are maintaining our homeostasis or homeokinetics, when due to our action, whether it is a stress with a high sympathetic response, activating your limbic system, hypothalamus pituitary system, the hormonal level gets altered. So number one is an altered or dysfunctional autonomic system, altered your hormonal imbalance, and third is your neurotransmitter imbalance. Your neurotransmitters are not in balance. So if you look at a lot of disease which comes from inside, say even a depression, your serotonin goes down. So give a medication to increase serotonin. If you even look at say Parkinson's disease, dopamine goes down. And dopamine does go up in the practice of yoga. The neurotransmitters are called DOS, D-O-S-E, dopamine, oxytocin, serotonin, and endorphin. These are the primarily neurotransmitters which alters causing our endogenous disease, and this is our healer. If you look at the medications being used today, large number of medications are either altering this neurotransmitters action, increasing or decreasing the neurotransmitters. So the healing power within is the neurotransmitters putting in balance. Altered hormonal homeostasis, that means hormone level keeping in balance. An altered or dysfunctional autonomic system, like putting the autonomic nervous system in balance. Normally, we have three nervous systems. A voluntary nervous system, I can open and close my hand voluntarily. I have an involuntary nervous system. That means if I look at a food, my stomach will start secreting juice, which I have no control. Then I have an autonomic nervous system, which is the control of my respiration, my heart rate, my gastrointestinal function, and primarily they are based on parasympathetic tone. So, a practice of yoga, which is a relaxation response, activation of parasympathetic tone, and by repeated practice, a yogi develops a neuroplasticity and control over autonomic nervous system. The moment you have a control over autonomic nervous system, you enter into the phase called empowering the healer within you. So the way that we practice starts. So how do you tap into your healer? You maintain a daily routine, which is called dinocharya, and primarily based on Ayurvedic philosophy. I have a lot of YouTube videos. In fact, last time, one of the videos being shared, skillfulness in daily routine. Next, you prepare your body and breath so mind can enter into the stillness. So again, remember the statement. Our body is capable of producing every medication which you take from outside. You have to quiet down your body and mind to the stillness, which is shasto, sha, still. Stillness of the self will cause the healing. Again, remember, healing, healer, healthy, hail, all means wellness. It's awareness, keeping your physical, mental, and spiritual body in balance. So the first practice, sit down with your spine straight. Sit down with your spine straight and quiet down your mind. The mind is the content of your five senses. I hear, I see, I smell, I taste and touch. Is the fifth limb of yoga called pratyahara, control of your five senses. And the most important sense is your vision. Eye is the extension of your brain. Brain is covered by the skull, eye is open outside. Eye is connected to a large nerve called optic nerve to your brain, and also supplied by the four cranial nerves, SO4, LR6, superior oblique muscle, supplied by fourth cranial nerve, LR6, lateral rectus muscle, supplied by sixth cranial nerve, trigeminal nerve supplies the eye. So eye is supplied by all the cranial nerves. So hand connects your body and mind. So the mudras, touching and quieting down your hand. You will always see people talking with their hand. You know, if you like something, you will say this before your tongue moves. Hand moves before your tongue. If you want something, you will do this before you can say, I want this. And you'll see quite often in the children. Children will say, you know, I saw babies eating. They will do this. They'll touch the tip of the hand. It's called more. They want more food. This is a sign of more. It's amazing when you see, if you see the baby's hands will be like this. Baby's hand will be like this, called a Balo Mushti Mudra. Because their body and mind is always connected. So touch your index finger and thumb. This is a Dhanu Mudra or Gano Mudra. It quiets down your mind, quiets down your pitta. It is the balancing between air and fire, and put it over your knees. Close your eyes. The moment you close your eyes, you are literally controlling your five senses. Remember one thing, when your one sense goes down, your other sense becomes more prominent. For example, a blind person who cannot see, the touch sensation becomes very important. They can touch and tell you what the object is. They cannot see. I had a patient who used to come to my office. She was blind from birth. She can used to touch my clothes and tell me what color of the clothes I'm wearing. Phenomenal, and she's almost always right. Close your eyes. Hand in the Dhanu Mudra. Access your breath. Breath is the connector between your body and mind. Metaphorically, if your body is like a roller flying a kite, and if the kite is the mind, the thread connecting the body, the roller, and the kite is your breath. access your breath. How to access your breath? Lung is like a balloon. It has 6-liter capacity and it needs 1.5 liter to keep it open. 4.5 liter of air can be exchanged, which is called vital capacity. Normally we breathe only 500 cc or half a liter. 80 to 90% lung function as a reserve. So as you know, if somebody has a problem with one lung, and if the one lung isn't removed, they're totally functional with the one lung. Since the balloon is full of all the dirty gases, carbon dioxide and other volatile substances, you breathe out first to make a room for incoming oxygen-rich air you are going to breathe. So breathe out first. And then slowly you breathe in and try to increase the time of inhalation without any effort. Meaning, as if it is your normal breath, you have no effort in breathing. Then you'll be breathing out longer than breathing in. 1.5 or 2 times than breathing in. Remember one very important thing: without any effort. Without any effort means you will be able to talk, you will be able to sing. Breathing is due to expansion and contraction of your chest cavity through the muscles of respiration, and all the muscles are skeletal muscles. These muscles can be trained. So you will be able to breathe in longer and longer and breathe out longer and longer when the neuroplasticity sets in or when you develop a habit forming. For example, we show it to you. I'll breathe out first. I will breathe in, count of 2 in, count of 4 out. Very simple way. Breathe out first. Breathe in with a count of 2 in, 1 and 2 in. Breathe out with a count of 4 out. Very simple, very easy. 2 seconds in, 4 seconds out. 6 seconds in a cycle. Normally our respiratory cycle is 15 to 16 breaths per minute. Just able to breathe 2 seconds in, 4 seconds out, you're already reducing the respiratory rate to about 10. Slower the respiratory rate, you are more healthier and you live longer. Very obvious in animal world. The animal which has the lower breathing rate, they live longer, like a turtle. And the animal who has a higher breathing rate, like dog, lives a lot shorter. With a practice of breathing out longer than breathing in, you develop the neuroplasticity, and you will be breathing like that when you are even sleeping. Breathing out, exhalation is parasympathetic. Breathing in is sympathetic. I'm already having some saliva in my mouth. Saliva in your mouth is a sign of parasympathetic activation. When you're fearful, when you get a bad news, when you're in stress, your mouth becomes dry because you have a sympathetic overdrive. When you are calm, relaxed, parasympathetic activation, you get a saliva in your mouth. Our whole gastrointestinal tract from mouth to the anal canal is supplied by your parasympathetic nerve. Parasympathetic nerve is called calm and digest. When you're able to practice this breathing slowly, you can increase it. Let me show it to you. I can do now 4 seconds in, 8 seconds out. I'll breathe out first. Very simple, 4 seconds in and 8 seconds out. We have been practicing for a long time, so I still can talk, can even sing. I started feeling the capillary pulsation on the fingertip on my hand mudra, touching index finger and thumb. Can clearly feel the capillary pulsation, and I can also feel the sensation started to going down. These are the signs that you are entering in the state of meditation and you are empowering the healer within you. You can keep practicing, breathing out longer than breathing in. Give another example now. 6 seconds in, 12 seconds out, without any effort. Breathe out first. It was 6 seconds in, 12 seconds out. Also, you breathe all through your nostril. When you breathe through your nostril, all the air goes to the larynx, trachea, and to the lung. If you breathe through your mouth, you have no idea where the air is going. When the air is really going to the larynx and the trachea, you might develop little cough. The cough comes from your larynx. That also tells you the air is going through the right channel to the lung. Even when you do a Ujjayi pranayama, when our larynx is slowly constricted, we also develop cough, and that's telling us we are constricting the right place. Let me show you count of 8 in, count of 16 out. 8 seconds in, 16 seconds out. It's almost 24 seconds a cycle. Little over almost 2.5 or 3 breaths per minute. I lived with the yogis and they are sitting next to me. They'll be breathing 2-3 times a minute and you will never know even they're breathing. They're so quiet and so calm. This will be 8 seconds in, 16 seconds out. Breathe out first. To the 8 seconds in, 16 seconds out, totally effortless. I'm talking, I'll be able to sing. If you visualize your breath, you bring your awareness to the breath and it becomes a breath-centered meditation. You enter into the meditative phase very quickly. You can also do an alternate nostril breathing. Remember, all these practices you are doing is to quiet down your body and mind to the state of balance. Visualize your breath. Visualize your breath that you are breathing out first from your nostril. Visualize your breath. Air is entering through your nose. Visualize the air is getting filtered. Our nose is a filter for all the dirty air we are breathing in. Our nose is like a personal air conditioner. Outside air is warm, is going to cool it down, and outside air is cool, is going to warm it up. It also adds your humidity in your air for proper humid air to breathe in. Air that goes to the side of your nostril, which is called turbinate, and turbinate creates a vortex on your air. The vortex slides over the mucous membrane of your sinuses, which opens up in your nose, and from those mucous membrane, substance is secreted through a nasal breathing called nitric oxide. Nitric oxide is a potent vasodilator. It opens up your blood vessel. It maintains your endothelial health. And remember, endothelial health is our health. Endothelial health is the healer within us. The moment you are in a sympathetic overdrive, your blood vessels are constricted, your endothelium is non-functional. Blood vessel is relaxed, endothelium is functional. Nitric oxide is also a mediator of parasympathetic tone. Nitric oxide, cyclic JMP, acetylcholine. Air is going behind your throat, going through the larynx, upper part of the trachea, going down the trachea to both sides of the lung. Entering the lower part of the lung, middle part of the lung, upper part of the lung. Upper part of the lung many a time doesn't get filled up. That's what you will see. A chronic disease like a tuberculosis is more on the right upper lobe. Lower part of lung expands, it descends almost to the level of a belly button. You wait for a short time, it's called cable kumbhak. Then visualize your air is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, going behind the throat, coming out through both the nostrils. Wonderful activation of the healer within you to bring your body, mind, and spirit in stillness and in balance. Breath is also carrier of prana. Prana is a subtle energy, non-measurable subtle energy which causes all the healing, keeps us awake, alive. When prana leaves us, we are dead. Breath is the carrier of prana. Breath is not the prana. Metaphorically, prana is like the electricity and breath is like the electric cable. In yogic tradition, our whole body does the breathing. So visualize the prana is coming through your breath, and the breath is going to the organ of healing. For me, I have the cardiovascular disease, heart disease, and my prana is coming to my heart to cause the healing of my diseased heart. If you have a problem with your back pain, knee pain, hip pain, prana will be going to the organ of healing. If you have diabetes, prana will go to your pancreas to to cause the healing and proper function of the beta cells and insulin. Tapping into your awareness and on your subtle body. We have three bodies: gross body, subtle body, and causal body. Gross body is connected to your physical body. Subtle body is connected to your mind, and causal body is connected through your spirit. Subtle body is the body of your mind. That means memory. I've been looking in my body and I developed a permanent memory of my body. So what happens if I want to access my subtle body? Now with my eyes closed, I can see my whole body. Every part of the body is accessible. I can touch my tip of my nose, I can touch my head, I can touch my chin, touch my neck, touch my left shoulder, my right shoulder, touch the back, I can touch the knee, my hips, back. I don't have to open my eyes. I got a funny, interesting story to tell you. In my shower, in my old house, in my shower, the light was not working. So a friend of mine who is an electrician, he came, he looked at it, and he couldn't figure it out. Finally he said, "Why do you need a light in your shower?" And he also comes from a little bit of yogic background, and he said, "You know your subtle body, you know every part of your body. After all these years, if you cannot access your body, if you're putting a soap in your body, you're going to take a shower, you exactly know. You don't need a light to see your body." It's a wonderful statement from a person who has a little bit of yogic background. So, subtle body is extremely important, and accessing the subtle body is actually the empowering the healer within you. See, for myself now, if you ask me, I can close my eyes and I can guide myself to a yoga studio, which we were teaching this class before. It is a septic space in Portsmouth, Virginia. I can clearly visualize I'm parking my car. I am entering through the front door. I've been greeted with a person who is running the place. I'm going to the yoga mat, sitting down in the yoga mat, and all of you are in front of me, and I'm starting a class. It is a classic example of accessing your subtle body. You can also access your mind through your Bhramri Pranayam, bumblebee breathing. In a Bhramri Pranayam, you shut down all of your senses, and then you create a vibration. Your brain and the whole body is in a state of vibration. Two vibration interacts. It is a principle of physics called harmonic resonance, and your body and mind quiets down. This is also called a mantra meditation. Mantra means mind. Man means mind. Tra is a container or is quieting down. So mantra is a vibration. There are different mantras for different organs. Different organs have a different vibration and different mantras have a different vibration. So in a classic Bhramari pranayam or a bumblebee breathing, what you do, you take your both the fingers, index finger in between eyebrows, third eye, use your 3 fingers to close your eyes, thumb to close your ear. You can also do a Shanmukhi mudra to do the bumblebee breathing or Bhramari pranayam. You will breathe out first. Take a deep breath in through your nose and breathe out to the sound of a bumblebee. So breathe out first. One more time. Little pumping and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth within your hand, if you're wearing glasses, remove your glasses. Take the hands like a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Eye is the extension of your brain. When eye is relaxed, your mind is relaxed. 2 muscles, ciliary muscles. Tightness of the ciliary muscles reduces the convexity of your lens. Relaxation of the ciliary muscles increases the convexity of your lens and improves your vision. Eye is supplied by the 4 cranial nerves. You are taming the 4 cranial nerves. Massage your forehead, massage your eyes, massage your face. All the muscles here on the face are attached to your skin. When the muscle is relaxed, all the frowning goes away, all the lines in the face goes away. Take your hand, massage the earlobe, massage behind your ear, in front of your ear, even in the external ear canal. There is a branch called auricular branch of the vagus nerve. It is a very calming and cooling. Even if you take a little Q-tip, which you don't recommend unless it is after shower, if you stimulate your external ear canal, you will see a sense of relaxation. There's a massage called Thai massage. In Thailand, there's Thai massage, and they do massaging the inner ear. It is to such a relaxation, they even call them a pseudo-orgasm. So orgasm is a parasympathetic activation. Wonderful therapeutic approach for massaging the ear and earlobe because it activates the vagal tone, which is a parasympathetic tone. Massage the side of the neck, which is the site of your carotid sinuses. Carotid sinus massage quiets down your cardiovascular system and nervous system. You massage your carotid sinus when you have a supraventricular tachycardia. Take your hands to the back, massage to the back of your neck, the muscles attached to your tubercle or occipital, trapezius, sternomastoid muscle, all are supplied by your cranial nerve. It's a wonderful relaxation response to take you to the level of the healer within you. Prayer pose to the back. Take your hands to the back. Slowly put it down, around, hands together like a prayer pose. And if you stay here a little longer, you'll be able to raise your hand. It's like you'll be able to see it. I'm sitting on a kneeling stool, so you'll be able to see it. I'm just turning it around. Prayer pose to the back. Paschim Namaskar. So when you do a prayer pose to the back, that Paschim Namaskar, and if you keep your eyes closed and quiet down, slowly and slowly, you enter into the state of a relaxation. Remember, muscles cannot stay contracted too long. When the muscle cannot contract it too long, it starts the relaxation response. And before the muscle starts to relax, it causes a little bit of fasciculation. So that is your called stillness. When fasciculation goes away, stillness. So tightness of the body and mind would prevent you from quieting down your body and mind to enter into that state of meditation. Meditation is medication. In this prayer pose to the back, Paschim Namaskar, you are relaxing your hands, relaxing your wrist, relaxing your elbows, relaxing your shoulder and the upper part of the body, the chest. And when they're also relaxed, remember, yoga practice is a whole, oneness, holistic. Holistic means whole. Rest of your body get relaxed. If you want to incorporate little neck relaxation, you can bring the Brahma Mudra, neck relaxation. Then you also can incorporate your Bhramari Pranayam, the bumblebee breathing. Bumblebee breathing quiets down your mind, extends your exhalation. With this Paschim Namaskar prayer pose, Brahma Mudra, relaxation of the neck, with the Bhramari Pranayam, bumblebee breathing, yourself will be quiet down to provide you with the health, which is Shasto. Sha is the self, Sto is the steed. Breathe out first. Drop your head down to the back slowly and breathe out with the sound of a bumblebee. When you drop your neck down in front, listen to your body's signal. What will be your body's signal? First one is a pain. If you get in a pain, you back off. Next one will be your effortless breathing. If you have any effort in breathing, you also back off. So one more time again, breathe out first. Slowly take a breath in and put your head to the back. You can put your neck side to side. Also look all the way to the back without turning your shoulder. Breathe out first. Take a deep breath in. In a practice, do it a little longer, maybe 4 times, 5 times. You can turn your also shoulder slowly to the left, to the back, to the right. Drop your head down, breathe out first. Deep breath in. Next we'll do right to the back to the left. So once you got the concept, relaxation of the physical body, relaxation of all the muscles and ligaments and the joints, effortless breathing, quieting down your mind with a vibration or with a mantra, or accessing your subtle body. Once your body and mind quiets down, your mind produces all the medications. This is in the brain called a limbic system, emotional brain, amygdala, hippocampus. So we have a medicine cabinet in our bathroom. We yogis also have a medicine cabinet of our mind. We hardly take any medication. We are medication-free, disease-free, enjoying a good quality life. We are like Energizer battery. Wake up in the morning between 4 to 6, then at 5 o'clock or 5:30 in the morning, we complete our morning rituals, sitting down, drinking 2 glasses of water, having a bowel movement first, brushing our teeth, doing a jal neti pat, doing 1 hour of practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation, little late breakfast because of your kapha time, main meal as a lunch, afternoon the exercise, and also eating fruit as a snack with all multicolor. And during lunchtime is a food with a 6 taste and 7 coloring, what's called a rainbow, 7 color of the rainbows. Small dinner, at least 2-3 hours before your bed. Drink a glass of water before going to bed and sleep by 10 o'clock. It's a wonderful lifestyle, and no disease will come close to you. Let's access our subtle body for a meditative alternate nostril breathing. Remember, a regular alternate nostril breathing also is very calming, cooling, and balancing both sides of our brain. Left nostril is controlled by the right brain. Right brain is intuitive, left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is calming, right brain is parasympathetic. Left nostril breathing is called Chandranari, moon energy. Right nostril breathing is controlled by your left brain. Left brain is analytical, male, heating, sympathetic. So when you do that, you do your Dhyana Mudra on the left hand, close your right nostril, breathe out through your left nostril. I'm just showing it to you. For the practice we do for a longer time. Breathe in through your left nostril. Close your left nostril with the ring finger and little finger, just underneath. You don't have to shut it down completely. And breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril, breathe out through your left nostril. Then put your index finger and middle finger in between the eyebrows and third eye. Bring your awareness to your third finger, to the third eye. Take your left hand, hold into right earlobe, which is super brain yoga and balancing both sides of your brain. Close your eyes and do the alternate nostril breathing. When you bring the same awareness in your subtle body, you will be able to do alternate nostril breathing without closing your nostril and doing it in silence. I will guide you for first few breathing. If you're practicing with me, then you get into silence, and once you enter into the silence, your whole five senses quiets down. Once you able to tap in your subtle body, it will slowly enter into your causal body. Dhyana mudra or Jnana mudra in both the hands, put it over your knees. Close your eyes. Bring your awareness to your left nostril. Breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. I can clearly visualize I'm breathing through my right nostril, breathing out through my left nostril. If you think it is impossible, do it few times, maybe few days, few weeks, you'll be able to do it. Now in your silence, do the alternate nostril breathing without closing your nose. You can continue for a longer time. You will feel, especially in your hand where you had a mudra touching your index finger and thumb, you will feel the pulsation, capillary pulsation. Slowly you will feel the numbness. If you have a health tracker, a Fitbit or an Apple Watch, you'll be able to see your heart rate is coming down, blood pressure is coming down, EKG is getting a normal sinus rhythm. If you have oxygen saturation, is oxygen saturation getting better? We have a new health tracker which gives us oxygen saturation, gives us continuous heart rate and continuous EKG. Bring your hands in front of you, put a lotus mudra, Padma mudra. Touch your little finger and thumb, separate your ring finger, middle finger and index finger. This connects your body, mind and spirit. It quiets down your body and mind to tap the healer within you. Slowly bring your hand close to your heart. Heart is the site of the soul, site of the wellness. Wellness is an awareness which carry with us. Wellness is the awareness, keep our physical body, mental body and spiritual body in balance. The moment you will be able to empower the healer within you, you will be a disease-free, medication-free, and enjoying a good quality life. Bring your hands together again, bow your head down, I call the Namaste. I honor the divinity within you. You are divine. We are all divine human beings. So wonderful experience having the healer within us, and the healer will do all the healing. We just have to do a practice to bring the stillness of our body, mind and spirit. Shasto, help, shaw, steed. Self is in stillness. Thank you for joining this Saturday morning session. We'll be back again with another topic and the practice. Comments, question, please put it in the Facebook and I'll be able to answer them. Try to do it on time. Generally I miss it, but I'll do it. Thank you again.